Hi YouTubers, it's Nurse Vonna here, and in this video I'll be talking about how a ICU nurse ended up in Med Surg. Usually you don't see an ICU nurse go to Med Surg, usually it's the other way around, and I will get into that. How did that happen? Was there any stigma, if any? Because it's like nursing world, you get what I'm saying if you're a nurse. I will also talk about ICU compared to cardiovascular telemetry, how different and how similar it is, which one I think is harder, which one I would do again, or if I would do both again. The main reason why I left the cardiovascular unit, also any future plans, any updates, so stay tuned. Okay everyone, so I will just jump right in. So as you all know, I've been an ICU nurse probably twice in my career. That was my first job. It was in the burn ICU and a level 1 trauma center where I live, and for the most part I liked it. It's just the management was just so trash. I just could not deal with that. So from there I went to oncology, and then from there I went back to ICU, which was a medical ICU, which again, the management was trash, and I ended up leaving. So for the most part, I did like ICU, which is why I was trying to get back in. I figured if I find a unit with better management, I could probably continue doing that, but no. In my previous video, I said how I was searching for a cardiovascular ICU job, and I came up, I saw the cardiothoracic unit job. So I'm thinking it was ICU, but you know, cardiothoracic ICU, which they did have at the hospital I was working at, and that's the one I thought I was applying to. But when I got interviewed, it was not that. It was definitely Med Surg. I will say in my interview, she did not clarify that it was a Med Surg unit. She did specify that they did some drips, but they didn't titrate. She didn't say they didn't titrate them, but she was basically saying the ins and out of the unit. So I figured, okay, it sounded like a step down unit. So I was like, okay, I'll take it to try it out. And I needed a job. So I took that job, and it turned out to be a Med Surg job. Now, I will say there was some stigma with me, and I was that typical nurse saying, okay, I'm an ICU nurse, why am I in Med Surg? Like, why am I here? This is not what I want to do. This is not anything I ever wanted to do. I always said I would never do it. And surprisingly, it was the longest job I stayed in since giving birth, which was shocking to me. I figured I literally started applying to ICU jobs immediately, because she said they take around 4 patients in my interview. So I'm thinking, you know, it's typical step down unit. But when I got there, she was like, oh, it can go up to 5 or 6. And I was like,
what? 5, 6, okay.
So it definitely was a Med Surg unit. And I've had clinicals in a Med Surg unit, but this one was nothing like that. So I will say the big difference between the ICU and the cardiovascular telemetry unit I was on is the patient load and titrating drips, also respiratory support. So in my unit, the cardiovascular unit I was on, we did do drips. We did not titrate those drips according to the patient's condition. We titrated them only if it was a heparin drip, or if the doctor ordered us to, based on their order. So we didn't have that ICU where you see the patient desatting, or so when you titrate up, titrate down, you know, we didn't do that. But we did have drips, which I felt was pretty cool, so I can still keep up with drips, you know, basically have that experience still there, even though as bad as I knew I could possibly titrate, I didn't, because that was not the protocol for that unit. Respiratory support, no vents. We didn't do any ventilation. We did have patients on BiPAPs and CPAPs and high flow, stuff like that. That's about all we did. Once they got to the point where they needed ventilation, they were sent up. So this was kind of similar to my oncology unit, which to me was a step down unit because we had, well, we didn't do drips there, but the patient was pretty sick and we only had 3 patients at a time. But this unit, they would literally have patients with like heparin drips that's not therapeutic, and you have like 4 other patients, and one of them have a drip that's not titrated, but you're still, you know, watching them. And then you have another patient on BiPAP or something. It just was like, why are we doing all this for this many patients? Because if something happens with one, you can't really, it's just a lot that you had to do, which I did not like. Patient load, and you know, in the ICU, the most patients I ever had was 2. Except in the burn ICU, we did have days where we took burns that wasn't as acute. So on those days, I would have like 4 patients or 5, and a step down patient, or in like 1 ICU, like 2 step downs, 1 ICU, which was another reason I left that unit, because I felt like I wasn't getting enough ICU, just ICU, even though it was good to, you know, cross train, but I was a new grad. I didn't want to do all that. But in that unit, we had the most 2 patients. This unit, it was 1 to 4 on a rare day, which I've had 4 patients one time, and that was only because the patient that was supposed to come never came, and that was the best night of my life. Other than that, I had 6 patients almost every night, and 5 patients when, you know, I didn't have any admissions coming in. So it was a mess. I hated it. Which one did I prefer? Honestly, I like the cardiovascular unit. I like the cardiovascular aspect of that unit. It was more cardiac than anything, but I still prefer ICU. Simply because I feel like I can focus my efforts on 2 patients at a time and manage them better than managing 6 patients with, you never know if one of these patients need to go to the ICU, which our unit, it happened a lot where a lot of our patients ended up being transferred to the ICU because they were so unstable from their surgeries that it's like, why did you come here so fast after your surgery? I don't get it. The cardiovascular unit I was on was basically post-op cardiovascular surgeries. Like, they would come from the CCU and then they would come to us. Sometimes if they just had like a cath or something and they didn't pull the sheath and all that, they would come to us. But at one time they didn't pull it and we had to pull it. That was my first time pulling the sheath, which was pretty cool, I will say. But I'm like, why are they here? They should not be here. It's just not safe. It wasn't safe, but it wasn't too unsafe to where I felt like my license was at stake. I felt like I honestly gained a lot more time management, and I didn't realize how much I can do in 12 hours for 6 patients. So I would say I learned more in the cardiovascular unit than I did in the ICU. I know you're like, what? Yes. Even though I learned more, like, I can't even say critical thinking, because I definitely was critically thinking in the cardiovascular unit. The unit was not normal to me. Maybe because I wasn't working for a while, I need to brush up on things, but I had trach patients sometimes. I had patients on NG tubes. I had PEG tubes. I had all the kind of tubes you could think of in this cardiovascular unit. So it felt like I was in the ICU anyways, except I'm not titrating drips and nobody is ventilated or sedated. I mean, darn, some of them really, they were so confused to the point where you're like, you need to be sedated. And those patients usually end up back in the ICU. So I really don't know why they have that unit like that. It is completely insane. But those are some bad ass nurses. I will say that. Even though, you know, there's some bad nurses in the ICU as well. But honestly, I think if we were to make the unit I was on, an ICU unit, those nurses would definitely thrive. And that's how I knew. I was like, I really think I could do CVICU. That's the ICU I've been trying to get in for the longest. That unit kind of made me want to do it even more because I did like cardiovascular that much. And then you get the telemetry aspect of it as well. And most of them have pacemakers, a lot of, runs of VTAC on certain nights. Sometimes the VTAC sustains so long to where it turns to a dang code. It's like, I have 6 patients. Majority of them are on telemetry. One night, all of my patients was on telemetry. So I'm like, this is too much. But this is standard for this unit. These nurses are trained to do this. I was trained to do it. I did it. I conquered it. I honestly was doing pretty good. I was on my own. Literally, after the first week, I was on my own. My nurses just checked. Really, they didn't check anything except like if I have questions or something, like something I've never done, like the sheath pull. I've never done that before. So they helped me with that. It was like little things, but I literally caught on so fast. But I honestly think I caught on so quickly because it felt familiar to me. It felt like I was in the ICU, but it wasn't as intense. And so I was like, let's just turn it up a notch and decrease the patient load, and I'm in heaven. I would have won day shift and stayed. Honestly, the main reason I left that job because I loved the management. I loved my coworkers. I ain't gonna say loved. I liked them. I liked my coworkers for the most part. My manager was the best manager I've ever had. To this day, I speak with her, and she helped me throughout all this mental health crisis that I was in. She helped me through that. And I really wish it was an ICU unit because I definitely would have stayed and went day shift. I feel if I did start out day shift, I would probably still be there, but I wouldn't stay there a year. I would be applying to go back to ICU, but working there to keep my cardiovascular skills up, if that makes sense. What else did I say I was gonna talk about? So which do I prefer? I prefer the ICU, but I like the cardiovascular unit more, if that makes sense. It's just that patient load is ridiculous. They really need to change that and turn it to a step-down unit because that's how good they were. And I've been to a general Med Surg unit, and it's not as intense. It's a lot of patient load. They do a lot of things. I'm not discrediting them, but it's not to this magnitude at all. So that's why I was able to stay there. I was interested every day. I learned something new every day, which I loved. So would I go back to the hospital? I don't know. If I did, it would have to be ICU. I won't do anything but ICU if I go back to the hospital. That's all I would do, honestly, because I can't handle that many patients. So kudos to the Med Surg nurses. Y'all are badass. Even if it's not cardiovascular, the fact that y'all deal with this many people, this many families, this many personalities every day is amazing. Because I was miserable. I could not do it at all. Kudos to y'all. Yeah, so that's pretty much it for this video. If you want a day-to-day about the cardiovascular unit, I can do that as well. That's a whole nother video. Literally, I would go with the start of my day, literally what I would do. And it's pretty similar to the ICU, so except I guess I can go through that. That's a whole nother video. So that will be my next video. I guess I would talk about that, but that's it for this one. I hope you enjoyed it. If you have any questions about what I talked about, let me know below, and stay tuned for the next video.